my name is Ashley Miller, and I'm here to talk to you all about communication. Communication is something that we go through day in and day out of our lives. It's something that we work on, and it's something that we don't work on as well. Depending on if we want to be around that person, we'll communicate a lot more, and depending on if we don't want to be with that person, we won't communicate very much. There are many different kinds of communication. For me, I feel like the most three important communications for me would be the perception and listening, the nonverbal communication, and the interpersonal communication. Perception and listening. I feel like that one is important because we spend more time reading and writing than we do listening. I know, crazy, right? We have to learn how to listen. Learning to listen could help us develop really good communication skills. It can make our lives a little bit smoother, things like that, if we learn to listen. Hearing is just sound waves coming in and out of the ear. That is hearing. So when we listen, we are also hearing, but we're listening to what they have to say. And we can give them very good communication, very good feedback, or not so good feedback, depending on what or how you are listening to that person. Listening is a huge role play in the medical profession. You need to listen to what the doctor tells the nurse. If you're a PCA, you need to listen to what the nurse tells you to do. And as a patient, you need to listen to what your doctor tells you to do. And also, if you are a nurse or a PCA or a doctor, you need to listen to what your patient is trying to tell you, is communicating with you. So listening in the medical profession is a huge ordeal. It's going to help you communicate better. Not just that, but if you're a doctor, you're able to treat your patient due to what you listened to, what your patient's concerns were, your diagnostics for that patient. And if you're a nurse, you're listening to what the doctor's telling you to give the patient as far as medical or the medications for that patient. So I feel like that the perception and listening is a very good form and kind of communication, especially in the medical profession. In relationships, you have to listen to what your partner's concerns are, and then communicate that to your partner. And then listening to what your partner's concerns are will help better communicate and also fix whatever their concerns were. So listening, I feel like we should take the time to learn how to do. It is a learning process on how to listen. It does sound crazy that we need to learn how to listen, but I feel like if we did take some time in our studies to learn how to listen, our lives would be a little bit more smoother. The other one that I find is important to me would have to be the nonverbal communication. Nonverbal communication is whenever you could just speak with your hands, your body language, and your eyes, as a matter of fact. How do you think people who can't hear you do? They speak with their body language and their hands and their eye contact. When somebody's making eye contact, you know that they're listening to what you have to say. If they're just looking away or not paying attention to you, they're not listening to what you have to say. So actually, nonverbal communication, we actually do day in and day out, whether we like it or not. People who can't hear you do sign language. That's how they communicate to you. If you don't know sign language, they're going to try to use their body language to help you understand what they are trying to commute to you. The other one that I find that is also important to me would be the interpersonal communication and the self-disclosure. We really need to be careful who we disclose our interpersonal lives too. You know, there are people that we can trust entirely, and there are some of people we can't trust entirely. So just be very careful with who you trust in your interpersonal communication and your self-disclosure. I feel like communication is a big role play in what we do day in and day out of our lives. These three happen to be the most important communication skills to me, because I feel like I do this daily, day in and day out. I do all three of these communication skills. I practice on listening. I practice on my I don't have to practice on nonverbal, but I do the nonverbal communication, and I also do this interpersonal communication self-disclosure as well. Thank you for listening, and I hope you have a good day.